Hi, I'm Lynsey Henry, and I'm back for another live event with Stigma-Free Society. Now, just to remind you, please take a moment to review our video disclaimer in the video description box. And we just want to make sure we're looking out for you and your during this time. So once again, I'm Lynsey Henry. I work as a school counselor in Surrey Elementary Schools for ages kindergarten to grade 7. And I also work part-time as a registered clinical counselor. Before this, I was also a kindergarten and grade 1 teacher. I worked in group homes for teenagers and have lots of experience working with youth and teenagers. So once again, we're doing these live events for you, and you can check out our Stigma-Free Toolkit at stigmafreetoolkit.com, and there's lots of really great resources there for you to check out, and new ones being added soon that we can't wait for you to check out. All right, so today I'm going to be talking a bit about obsessive-compulsive disorder in children and in youth. Now, I originally started researching this topic more because I received a client in my private practice who was a youth and thought they may be experiencing some symptoms of OCD. So this is a great opportunity for me to research more and share my knowledge of those resources with you today. So why might this be important to talk about today? Well, during COVID-19, we might just be overall concerned with our child or our youth and their cleaning and sanitizing behaviors around COVID-19 and protecting ourselves. So we might wonder, are these normal? Quote unquote normal. I don't really like that word personally, but are they normal or are they more problematic and affecting their daily routines, school life, social life with friends, and so on? So that's when it becomes more of a problem and more of a mental disorder, is when it's affecting all areas of our life and our routines. So a really great website to check out about any mental health disorder in children and youth is the Kelty Mental Health website. And they have a really great overview of a lot of different disorders that you see in children and youth. And it really breaks it down well to show you different symptoms to look for, more resources, and so on. So I'm actually using some of their content today in my presentation to help educate you more about OCD. So there are two different parts in OCD. There's those obsessions. So those are those unwanted thoughts, ideas, or urges that are distressing. And they may seem strange or have to do with things that you normally wouldn't think about doing. You can't control obsessions because they cause a lot of anxiety or bad feelings. So some examples of obsessions in OCD might be something around cleanliness or infections, might be something about bad things happening, or about the child's identity or morality. The second part of OCD is compulsions. So those are those things that you keep doing to lessen the feelings of distress to prevent that bad thing from happening. But these behaviors or mental acts only work for a short time, so you have to keep repeating them, and they start to interfere with your daily life. For example, if a child or youth has obsessions about getting very sick, they might want to stay away from sick people, maybe even away from school, and ask their parents again and again if they'll be okay. And this is common right now with coronavirus, children asking, is it going to be okay? When is this going to be over? So it's important to kind of look at these symptoms and differentiate, like I mentioned at the beginning. These repeated behaviors like hand washing, checking, and cleaning are part of the compulsions. So compulsions take up a lot of time and affect the way that we live. So children and youth with OCD may have trouble concentrating or controlling their emotions and become extremely angry when they're not able to follow through with those rituals. They may not see that the obsessions and compulsions are unreasonable or are causing them problems. And this often overlaps with other different mental health disorders, including anxiety, depression, tic disorders, and ADHD. So you might be wondering, well, when is this problematic and how do I tell the difference? Overall, if the disorder takes up a lot of time and interferes with daily ways that the child functions, for example, socially, if they're starting to avoid their friends, not wanting to participate in hobbies like sports they used to participate in, if they're starting to feel kind of rejected from their peers and just isolating themselves. That would be a big sign. If at school or work, they are staying home and struggling to concentrate, their schoolwork might take much longer because they're distracted with these obsessions and compulsions. With family, there might be fighting happening, some stress. The amount of time and money others are trying to spend to help the child with the problem. Personally, they might be feeling down or sick of being distressed and not able to enjoy their hobbies. So it needs to be persistent as well. So that means not just in the case of COVID-19, this is a situational thing that we're going through right now. For it to be a mental health disorder and diagnosed as OCD, it needs to be not just that situation of COVID-19. It needs to persist outside of situational forces. So that's what you need to look for as a parent or a professional, that to see that it's indifferent across different situations, that this is still a struggle for the child. Okay, so is OCD situational from COVID-19? Is it possibly some health anxiety, just anxiety around health problems in general? Some questions you might ask. Did these symptoms persist before COVID-19? Are they persisting after COVID-19 safety regulations are lifting or lessening, like I mentioned before? Did the child always have health anxiety before this? So once again, that's kind of what I was speaking about before this. You might think of some celebrities. You might be familiar with Howie Mandel, and he has obsessive-compulsive disorder and spoke quite publicly about it. And his was more of a germophobia, so a fear of germs and wanting to wash and clean were the compulsions related to that. So sometimes it's really helpful when we're looking at mental health disorders to think of a celebrity or somebody that's spoken publicly about it, to really connect with what that means and what that might feel like to have OCD, and listen to their stories. All right, so what are some different treatment options for OCD for children? Well, the biggest treatment option is exposure and response prevention. So it's a type of cognitive behavioral therapy, and it's particularly good for OCD because we gradually start to expose and face the fears to lessen distress in the patient or client. And then we help them cope and resist those compulsive behaviors. So that might be checking to make sure the door is locked. That may be the washing of the hands is the compulsion behavior. So this is the first line treatment for OCD. And it works well for most people, the majority of people. And you can find a lot of self-help resources out there that are free. A great one I'm going to share with you is the resources from Anxiety Canada, and I'll show you some of their resources in a moment. Also, individual therapy, you can also do exposure. I've worked with an adult client with OCD, and we went through exposures together, both imagined exposures where I read a script to the client and she had to visualize what it might be like to be in that situation that she feared, and also in vivo exposures. So that's when we actually do the exposure with the client. So an example of that I did with my adult client was going around in the office and getting her to touch the door handles. Now this was before COVID-19. It was last year in my practicum. So getting her to go around, touch the door handles in the office, and then not allowing her to do the compulsion behavior of washing her hands right after doing that. Having her sit down and do progressive muscle relaxation or meditation with me helped ease her anxiety around those fears. And then later on at the end of the session, I allowed her to wash her hands. So that's just one example of how exposure can be done, and it can be done with both adults and children. And the most important part as a counselor in working with someone while doing exposures is not to flood them with the experiences. So flooding is when you give somebody a exposure that's way too high on their fear ladder. So something that's a 10 out of 10 for them in their fears, something that they could not cope or handle with without support. So you wouldn't want to start there. You want to start baby steps and gradually go up the ladder or the stairs to something manageable for the person with OCD. So Family members, especially for a child or youth, family members really need to be involved in the therapy and be taking home exposures and getting the child to do the exposures at home as well, and continually practicing that will really benefit exposure therapy and make it more effective. Okay. Some other things in combination with exposure therapy that are proven to be helpful for some people are SSRIs. So that's a medication. Selective serotonin reuptake inhibitors are sometimes prescribed to reduce OCD symptoms. And of course, we want to keep in mind there are pros and cons of medications, and to always seek help from a doctor or psychiatrist that's knowledgeable in medications before making those decisions. Okay. So what do I do overall? If I think my child has OCD, what should I do first? Well, the first thing that you're going to want to do is visit your family doctor, and they can give you a referral to a psychiatrist, and they're likely going to mention getting you to go to the Child, Youth, and Mental Health walk-in clinic. And in Surrey, you get to go do this on Wednesdays at a local walk-in clinic. It's actually connected to an MCFD office, and there are youth mental health workers there that take you in, and they specialize in doing these assessments to fully cover the range of symptoms that your child might be experiencing. And often they do have quite long wait lists, but they can also connect you with other community supports to help you in the meantime while you're on their wait list. People like myself, like a registered clinical counselor, I get a lot of clients from people that, from children that are on the wait list for child, youth, and mental health. And also contact a psychologist, someone like Dr. Dana, and they will be able to help you with that exposure style therapy or another form of CBT, cognitive behavioral therapy, whatever they see is best fit for the client or the child. So some of those resources I wanted to tell you about. There is one for general health anxiety by the Center for Clinical Interventions, and it's a self-help resource. So I'll add that to the comments section at the end of my talk for you to take a look at. As I mentioned before, Anxiety Canada has a lot of exposure resources. So I'm going to show you some of them here. This is my favorite, so I've laminated it for my office. And it's kind of like a thermometer of exposures. And if you can read it, it describes it in that scale. So 10 out of 10 fear is something that makes you the most scared ever. I'm terrified. So that's the worst fear. And something around 8, something that makes me very scared. I want to get out of here. Something that's a 6, I'm scared and it's hard to cope. Something that's a 4, I'm starting to get worried. I can feel it. Something that's a 2 is I'm a tiny bit worried, but it's hardly noticeable. And at the very bottom of the scale is 0, I'm calm and I'm chill. So these type of visuals for children and youth especially are really helpful because they can relate this to seeing a thermometer in the winter or summertime and the way it looks. So visuals, very helpful for children to relate to. And usually what I do is I put kind of a rock or something and get the child to put the rock on which number they feel on the scale before we do the exposure. So I can get an idea if it's a challenge that's too high or just right, and so on. Because we don't want to flood them with too big of an exposure, otherwise they're not going to want to do it again. So baby steps, wanting to start somewhere around a 3 or a 4, that they're feeling a bit worried, but not so worried that they will never want to try exposures again. So that's a great example I use in my office. There's a couple different ones from Anxiety Canada, different types of fear ladders. And it talks about the fear rating, gets you to write the step. So step would be 10 out of 10, 9 out of 10, and go down all the way down to 0. And the goal, what are we wanting to accomplish here? And the situation, what is the situation that's feared in each of these examples? And it needs to get harder and harder as the numbers go up. Another helpful worksheet from Anxiety Canada, an exposure tracker. So this is good for families that are following through with therapy at home, getting their child to still do these exposures at home and tracking them. And once the child's done an exposure, why not reward them for that? And maybe ice cream, maybe free extra time on their tablet, maybe a preferred activity, or a game night for completing, say, 5 exposures in a week. or whatever's manageable for you at home. So I like the idea of tracking the exposures and when they were completed in combination with the counselor showing them when those have been completed. Here's another one about monitoring anxiety. Talks a bit about the situation, what the thoughts were around that, how it felt in the body, and what I did or what were the actions. Did I leave? Did I avoid? Or did I ask for help in facing that fearful situation? How did I manage my anxiety? All right, and at the very end, I'm going to do a quick fear ladder activity with you and an example of something I would do in session with clients. So that's Anxiety Canada's exposure resources, and I'll post those below in the comment section for you. As I mentioned, there's a lot of other really great resources from Kelty Mental Health. One is a website called OCD in Kids that I'll link, another one called Beyond OCD. There is YouTube videos from Oreen Wagner, who's a specialist in OCD, and she has several free clips for you to view on YouTube about OCD in general, what parents can do to help, what makes OCD worse, what's normal versus what's OCD. Okay, the last couple here, I have a book called Up and Down the Worry Hill, and that's a children's book by Oreen Wagner on OCD, and it's really helpful, and I want to purchase it for myself as a counselor because it looks like it would be a good one to share with children. Workbook, there's a good one by Dawn Hubner called What to Do When Your Brain Gets Stuck, a kid's guide to overcoming OCD. And that's something that you can do with your child at home as a parent, and I think it's only around $20 on Amazon. So there's some helpful resources. My favorite out of all of them, there was a cool comic on the OCD website, and it's kidsiocdf.org, and I'll link that one. It's a really cool comic and goes through some experiences a child with OCD may be having, and I like the comic-friendly language and the relatableness, just to normalize OCD and really connect with children that are experiencing those struggles. Ooh, I forgot about another one too. There was a documentary that I'll link that was free as well about kids talking about their experiences with OCD and also talking about those different exposure therapy strategies and how they felt in doing the exposures. So I thought that was really helpful as well. Okay, so I'm going to pause for a moment here to look at some questions, and I can see some already up here, so that's awesome. And then I'll get to that activity with you that I do with clients that are experiencing OCD symptoms called a fear ladder. So let's have a look here. Do all people with OCD have anxiety? How is this different than anxiety with OCD? That goes back to, well, OCD is a type of anxiety, but with OCD, you have the obsessions and the compulsions. So the compulsions are those things like checking the door, checking to make sure the oven's off, washing your hands frequently, and those sorts of things. So just generalized anxiety wouldn't have those behaviors or those rituals that are repeated in order to decrease the anxiety. So hopefully that makes sense. Can OCD symptoms get continually worse if people do not receive treatment such as exposure therapy? I believe so, because it's just that cycle. They're going to keep doing the rituals or avoid the situation altogether. So that can become really problematic and turn into an anxiety disorder called agoraphobia, where the person doesn't even want to leave their home because they're so anxious about different situations. So by using the exposure therapy and gradually exposing the person to the feared situations, it's going to do something called extinction. So that's something familiar in behavior therapy. So if you've ever taken a psychology class or have heard of B.F. Skinner or all those behaviorists, and the way that they the extinction of behavior is by slowly exposing and getting rid of the stimulus and the fear and the response. it's kind of complicated, but if you look at behaviorists and common psychologists, one is B.F. Skinner, and it talks all about exposure and how to break conditioning, and it's a conditioned fear response to a different situation. And in order to get rid of that response, we need to expose ourselves gradually to those situations and get our self-regulation or our feelings to come down and get to a state of calm. So thank you for that question. How is managing OCD symptoms different at home than at school? Well, I think home for children is a more controlled environment where, say, they can complete those compulsive or those ritualistic behaviors more easily. Whereas at school, for a child experiencing OCD, their peers might start to notice if they're doing those compulsive ritualized behaviors more often, such as washing their hands or such as checking the door. Their peers are going to start to notice the symptoms more often, and we all know from experiencing school, elementary school and high school, that our peers can be a huge impact on our life and in bullying situations and whatnot, that we don't want to have that impact for our child to have these negative experiences with their peers. So I think at home, by practicing these exposure exercises, it's going to only benefit the child at school to reduce their compulsive behaviors and rituals. So hopefully that's helpful. Is there a stigma related to OCD, and how can students cope with that? Yeah, I think a lot of people just brush it off. Oh, I have OCD too. And just use it as a saying. And that's the stigma, because OCD is a real mental health disorder and a real struggle for a lot of people. So by just saying that and being kind of ignorant and just saying it in passing, can really hurt and impact people that struggle with the mental health disorder. So I really urge people not to use that saying and to reframe what they're saying into something more positive. So yeah, okay, I like to clean a lot. Instead of saying, oh, I'm so OCD, I like to keep my house so perfect like this. So just try not to use that term. Try not to use any sort of mental health diagnosis in a conversation like that, I think, is what I would advise. How could students cope with that? You learn to advocate for yourself and speak out about your story and become more confident and say to people, hey, what you're saying there is not okay. And I don't appreciate that, because I actually suffer and deal with these symptoms on a day-to-day basis. So please don't talk that way around me. So I think it's a bit about growing up and getting more confident to advocate for our mental health and the way people use those words and how they impact us. So thank you for that question. All right. So I think that's all the questions for right now. If anybody else after this live has any questions for me around going back to school during this tough time or anything like that, please feel free to leave me a comment in the comment box, and I will get back to you with what's been going on the last few days in our transition back to school or other mental health concerns in general. All right. So I have a fear ladder that I would like to complete with you just to get an idea of what that might look like for you and for different situations for your child that might be experiencing OCD. So my fear ladder looks like this. And once again, I got this handout from Anxiety Canada. You can print them off for free. They have a great explanation of how to do these exercises with your children and even kind of like a script. Okay, so let's think of an example. If you have an example for me in the comment section, you can let me know, and I can kind of advise you how I would break that down. Today I'm going to use the example of touching objects in public places, since right now that's kind of a huge one, and it's a huge one for people with OCD in general. So at the very top where it says, what is my goal? I'm going to write touch objects in public places. And a good example of that might be the supermarket or the mall. So I'm going to use the mall as an example. So this is how it would look at the top of your fear ladder. All right, and they have that scale here for us, 1 being no fear, 10 being extreme fear, 5 or 6 being a moderate fear. So remember, when we do an exposure exercise at home with our child and follow up with our counselor, you should have a registered counselor you're working with as well. Make sure you choose something that's not too high. Otherwise, on the fear ladder, otherwise your child's not going to ever want to do this again with you. So start small, start with baby steps. So start with something around, I would say a 3 or a 4 on their fear scale. Okay, so let's look at break it down, the fear ladder, into those different steps. So here we have 13 different boxes. So I'm just going to number them down. 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, so we think about going to the mall and touching objects in the mall, in a public place. So let's think. For a 1 on our anxiety scale, that might be just walking around the mall or being in that public place. So I'm going to write walk around the mall as the situation at the very bottom. Okay, and we're going to think about the fear rating. Where does that sit for me on my fear rating? Just walking around the mall, it makes me a little uneasy. So I'm going to put it at a 2 out of 10. And let's just go back to that helpful visual here too. Okay, so a 2 is feeling a little bit worried, but hardly noticeable. All right, so now we're going up next step on the fear ladder. Sitting on a bench at the mall might be something a bit higher on the fear rating, because what if this bench isn't contaminated? What if somebody didn't wash their hands and sit on it? So that would be something closer to a 4 out of 10, which is when we're starting to feel worried and I can feel it in my body that I'm worried. So I might be sweaty, my heart might be beating faster, I might be fidgeting and having worrisome thoughts. Okay, so next on my fear ladder might be touching items in a store. And there, I'm up to a 5 out of 10. So there, I'm starting to get scared and worried, and it's getting really hard for me to cope. Okay? And next up my fear ladder might be touching a railing at the mall. And that's somewhere that more people touch when they're going up and down the stairs. So that's going to give me even higher of a fear response, maybe a 6 out of 10. Okay? Next, I'm at a step number 5, and that might be sitting on a bench at the mall and touching it with our hands. That might be a 6 out of 10 on my fear rating. All right, so something higher might be touching a table in the food court, because maybe the people there forgot to wash their hands, and in my head that's really scary that they were eating and touching their mouths and touching the table. Touching a table in the food court, that might be more like a 7 out of 10. Okay, next, using my hands to push open the door of the mall entrance, because that's a high traffic area, and that's going to make me more nervous than some of the ones at the bottom, maybe a 7 out of 10. All right, using a public phone at the mall. So maybe you had to borrow a store's phone or something like that. That might be an 8 out of 10, because maybe they don't sanitize that much. So that makes me even more nervous. Okay, 9, touching a garbage can at the mall. Ooh, there'd be lots of germs there. So that's going to make me feel an 8 out of 10 on my fear rating. Okay, a couple more left to go. Touching a knob on the bathroom door at the mall. That's going to make me up to a 9 out of 10. So remember, a 9 out of 10, that's almost at that 10 out of 10 level where I'm most scared, I'm terrified. Okay, Touching the counter and the taps at the mall. Still a 9 out of 10. Highest, using our hands to open and close the stall door. Whereas someone with OCD might pull their sleeves down in order to prevent that. And that's a 10 out of 10, terrifying. Using the toilet at the mall is the top of my step ladder, and that's a 10 plus, the worst fear at the very top. So like I said, when you go do these exposures in real life, you're not going to want to choose the top one. So don't send your poor kid to the mall and get them to use the toilet right off the bat, because that's going to flood them with a very stressful experience. Start somewhere lower down the step ladder, somewhere around a 3 or a 4, if their fear is touching things in public places like the mall. So start somewhere around sitting on a bench at the mall. And get them to sit there 5 to 10 minutes and get them to practice a coping strategy that their counselor has taught them, whether that be something like deep breathing, using a fidget tool or a fidget bracelet, getting them to visualize their peaceful place, and get them to come down. Don't allow them to do the compulsive behavior of washing their hands or sanitizing their hands right away. Delay that experience or that ritual behavior for the extent of the exposure, whether that be 5 to 10 minutes is reasonable amount of time. Okay, so that's exposures in a nutshell. And you can find more information on Anxiety Canada's website, and they'll walk you through further how to actually experience this exposure and bring your child's level of fear rating down and get them to cope with the situation. So thank you so much, everyone, and I'll see you in a few weeks for another presentation, and check out all our new resources at stigmafreetoolkit.com. Thank you. Take care.